So why is it very dangerous to have a large patent foramen ovale is because let's say that this is a hypothetical heart and this is a patent foramen ovale. This is the right atrium, the left one, the right ventricle, the left ventricle. So what happens is that since we know that the patient had a lot of factors which led to hypercoagulability and led to a clot formation and which later embolized. So an embolus was present, okay? Now what happens is that in a normal person, what happens that this embolus goes to the, let's say, to the right atrium via the veins, from the arteries to the veins into the right atrium and then the right ventricle, and then it goes towards the lungs where it is filtered out somehow. They absorb it and then into the heart. Nothing enters, okay? The embolus does not enter, so it is not that dangerous because it cannot go to the brain in this case, because brain is very sensitive to anoxia. But in this case, when the foramen ovale is patent, this embolus, let's say this is the embolus, it will directly enter the left atrium via this hole, okay? It will not go into the right ventricle and into the lungs. So when it will directly enter the left atrium through the hole and then to the left ventricle and then through the aorta and then to the brain, then it will definitely cause a stroke, or in this case a mini stroke. Okay, so this is the mechanism, and this embolus which goes to the foramen ovale directly from the right atrium to the left atrium is known as a paradoxical embolus. Okay, always in a young patient of stroke or mini stroke, always consider a paradoxical embolus. Rule it out by investigating for patent foramen ovale.